The number of cholera cases in South Africa has risen to 11 after the confirmation of new cases in Gauteng this week. None of the new patients had travelled outside the country's borders recently, and this raises questions of local transmission. They're all currently in a stable condition and recovering at home. Let's find out more from Foster Mohale, who is the spokesperson for the Health Department. Mr. Mohale, thank you so much for speaking to us this evening. Let's start off by finding out from you how many cases have been confirmed this week.
Good evening to you, Hanley, and good evening to your viewers at home, and thanks for this opportunity once more. Yes, as the Department of Health can confirm that as of today, the number of cholera positive cases in the country has risen to 11. So remember that 2 days ago we've announced that there were 4 more cases of cholera, but unfortunately yesterday we got the news that one of the contacts of the 4 is tested positive, which is a 3-year-old child.
So 5 new cases in 1 week, all of these indigenous. Am I correct in saying they're all within Gauteng, so none of them have been imported?
Absolutely correct. Or about 7, all of them, 11 are in Gauteng. 7 of them are under the city of Johannesburg, around around Diepsloot. Then the 3 are in Ekurhuleni district. So, which is a very worrying, it's a concern for us as the Department of Health. That hence we want to intensify our health education awareness in order to empower our people with more information in order to make well-informed health choice as far as this cholera is concerned.
So 3 of those cases were detected in people who had taken part in the same traditional healing ceremony within the greater city of Johannesburg. Can you tell us what this ceremony entailed and how it's linked to cholera?
Yes, about the 4 that we've announced 2 days ago, have admitted that they experienced severe health complications few days after they underwent the baptism practices in Jaski River, which is around Alexander and Santen. And the other one was also undergone the baptism practices around Ekurhuleni at a river called Klep River. So we are very concerned that, and also to say that as they admitted that during the course of a baptism, they were also advised to drink the same water that were baptized in, which is very concerned because we cannot guarantee the safety of the water from the rivers that are flowing all over the country. So hence we want to advise our people to say, especially the religious and traditional leaders, to say, as they continue with their religious and cultural practices, we advise them to avoid telling their church members or their followers from drinking the water flowing from the rivers, because we cannot confirm the quality of the water. Hence, we have assigned our healthcare practitioners to take the samples of this water to lab for testing in order to establish if there are links, if this water is contaminated with cholera, in order to make a well-informed choice as the department. So for now, we say please avoid drinking or using the water from the rivers, water from the dams or any other streams if that water is not treated. So we advise people to use the tap water. Otherwise, we also are aware that the issue of water, access to water, is a serious problem, especially in the informal settlement, squatter camps. So we say, as much as we've got the problem of water, but it's safe to drink the water from a reliable source like a tap water.
This has been labelled an outbreak. With 11 cases, is there cause for major concern? And tell us, while you're answering that, how cholera spreads and what the dangers are with, with close contact.
Yeah, for now it's too early. Of course, we cannot say people must relax. For now, it's too early for us to declare an outbreak of cholera, especially as have indicated that only 2 cases, the first 2 cases, we know that they were transported from Malawi, where currently they're battling with cholera. But all the 9 cases that we've detected in the country, we are still trying to establish the main source of these infections. Hence, we said we identified the 2 rivers, the Klep River water and the Jaski River, as the suspected sources of this local transmission. Until we get the results from the lab, it's going to be difficult for us to say, yeah, this is the local source of this infected. So for now, we say, please, let's try to maintain hand hygiene. Let's avoid water which we cannot guarantee the quality of the water. But we urge people to say, if they want to use the water that they cannot guarantee the safety, let them try to treat that water first. They can treat the water through boiling the water first, or put some 1 or 2 spoons of jig before they can use the water.
What are the signs that someone should be tested for cholera?
Of course, the cholera symptoms, signs and symptoms, they are not completely different from signs and symptoms of other health conditions. But here we talk of vomiting. One can vomit from time to time. One can experience dehydration and watery diarrhea, and also experience body pain. So we want to urge all our people, all South Africans, to say anyone who experiences these symptoms with or without travel history locally or internationally, they should visit their nearest health facility, a clinic or hospital, so that the healthcare workers can be able to screen and test. And if they test positive, they can be able to be given a treatment without any delay, because early detection saves lives.
And talk to us about these water sources. You've said that you suspect that both the Yixke and the Klip River could be the sources of these recent cases of cholera. How does cholera get into a water body, and then how is it removed? How is that water then made safe again?
Normally, as we said, the cholera spread through contaminated water or any food. So hence we say, for now, we suspect the water from the 2 water streams, precisely because all 4 cases that we've confirmed a few days ago, they admitted that they only experienced the signs and symptoms of cholera just few after they drank the water, which they could not guarantee the safety of the water.
It seems, unfortunately, we have lost Health Department spokesperson Foster Mohale, giving us an update on the situation with cholera in the country. Currently 11 confirmed cases, of those 1 fatality.